Okay, so I'm going to be doing wound drainage and assessment and irrigation cleaning. So the first thing I'm going to do is I'm going to do some hand hygiene. I'm going to introduce myself to the patient. Hi, my name is Talia. I'm going to be your student nurse today. We're just going to be changing your wound dressing and cleaning it out. Is that okay with you? Okay, great. I'm going to lift the bed for my body mechanics to my waist level. I'm also just gonna assess for pain and ask her if she has any pain. If she says yes, I'm gonna administer some pain medication, then leave for 30 minutes and then return. And then I'm gonna ask if she needs to use the bathroom. She has no pain, she doesn't need to use the bathroom. Okay, we're good to go. Just gonna do hand hygiene one more time to be safe. So I'm just gonna put on my gloves. Okay, so I'm gonna place my blue pad down just underneath the wound. If you could just lift your hips for me, that would be great. Okay, awesome. So I have the blue pad down. Next, I'm just gonna set up my garbage. So I'm just gonna take this off. I'm gonna assess for drainage. It's Seneca. Okay, I'm gonna throw that out into my garbage. Now what I'm gonna do is I'm going to measure the wound with my cotton swab. So I'm just gonna open, I'm gonna peel it open here if I can do it. We're so close. We're so close. You know what? I'm gonna take my glove off and let them do it because I can't open it. You know what? I'm gonna hand hygiene. I'm gonna re-glove. I'm gonna open a new stitch. Putting my gloves on. Again. Okay, now I'm gonna rip it open, pull it out. Now we're just gonna measure the wound. So without actually touching the wound, I'm gonna go, okay. So I would say that's around 5 inches. By 2 inches. And then I'm just gonna assess the depth here. Okay, that's about 2.5 inches, okay. So now I'm gonna discard this. I have the measurements. And I'm going to take my gloves off and I'm going to prepare for irrigation. Okay, so now I'm gonna begin to open my sterile tray.
You know why? Because
so I'm gonna open it away.
okay.
We're just gonna spread it out here. hydrate. I'm gonna open my solution and I'm gonna lip it. Okay. And then I'm going to pour it into my sterile tray here for my irrigation and my cleansing. I'm just going to take out my sterile scissors here. Come over there. Opening up my syringe. And the tip, the needle. And I'm just going to open up my blue pad. And then the last thing I'm going to do before I put my sterile gloves on is I'm going to take out some of my ribbon. Okay, so I'm just going to approximate how much I would really need. So, okay. We're so close. So far. There we go. Okay, I'm gonna cut it. That. These are now not sterile. We're done with this. Okay, now I'm gonna put on my sterile gloves. Okay, so these are my sterile gloves. Okay, so my sterile gloves are now on. So the next thing I'm going to do is I'm going to extend my sterile field before I begin my irrigation. So with the shiny side down. Okay. So I'm going to take my syringe. I'm going to suck up 30 milliliters. Twist it into here. Now I'm going to irrigate. So in a zigzag pattern from top to bottom. And I'm just going to Keep going. I'm going to cap this back up and it's going to go into my sharp spin. Okay, so now the next thing I'm going to do is I am going to clean my wound. So using my forceps here, I'm going to take my 2x2s and I'm going to put them in my solution. And what I'm going to do is I'm going to fold up all the ends together to form a dumpling, so that none of the edges touch the wound. And I'm going to go one here. Okay, throw it in my garbage. Taking another one. Doing a dumpling again. And then I'm going to take a 4x4 and I'm going to make a dumpling again. And we're going to go down the middle. Perfect. Okay, so now that it's all clean, what we're going to do is we are going to pack the wound. So I'm going to take my packing ribbon. It's covered in solution. I'm going to wring it out wrapping it around my fingers like this. And then I'm going to take my forceps and without touching the edges of the wound, I'm just going to place it in like this.
No, but that's just like funny. Like, oh my god, I don't like that at all. I really don't.
Okay. And we're gonna leave it just like that with the edge sticking out a little bit for the next nurse so she knows. Okay, and then the next thing I'm gonna do is I'm going to take my...
There's 2 minutes remaining.
I'm going to take my 4x4.
Like a lot.
Then I'm going to take my blue pad with the line up. And I'm gonna push it like there. Okay, perfect. So I would be done, but I did not measure the tape correctly. So I'm gonna take off my sterile gloves. I'm gonna do hand hygiene. I'm gonna measure my tape and then I'm gonna put on clean gloves to tape the edges.
No, that's not mine.
Okay. So I'm going to do hand hygiene one more time. I'm going to put on a new pair of gloves. I'm going to tape it up. Okay, perfect. I'm now going to remove everything. Are you doing okay? Everything's good? Okay, great. And I'm going to lower the bed to the lowest position. And I'm going to take my gloves off. And my last step is hand hygiene.